Most people think that using the bathroom just in case protects them from accidents. But this well-meaning habit can slowly train the bladder to hold less and react too quickly, leading to more urgency and unexpected leakage instead of less. If you often use the restroom before leaving the house, before a car ride, or even when you don't really feel the need, just to be safe, you are not alone. Many seniors do this every day, believing it prevents problems. But few stop to ask whether this routine is helping the bladder or quietly working against it. I've spent the past 10 years working in preventive health, helping older adults stay active, confident, and independent. Today I want to talk calmly and openly about bladder health, something many people hesitate to discuss, yet it affects daily comfort and quality of life in a very real way. In this video, I'll explain how the bladder naturally works, how a common daily habit can gradually reduce bladder capacity, and what gentle, practical changes can help restore healthier bladder patterns. I'll keep everything simple and easy to follow. By the end of this video, you'll understand how to recognize early signs of bladder irritation, how to support bladder strength in everyday life, and how small adjustments can make a meaningful difference in confidence and comfort. Let's begin with a simple picture that makes this easier to understand. Think of your bladder like a soft, flexible water balloon. As urine is produced by the kidneys, it slowly fills this balloon. The bladder is designed to stretch comfortably, little by little, without causing discomfort. When it reaches a certain level, gentle signals are sent through nerves to the brain, letting you know it may be time to use the restroom. Under healthy conditions, this signal builds gradually. It feels manageable, giving you time to finish what you're doing, walk calmly to the restroom, and empty the bladder without stress. This natural rhythm between filling and emptying helps keep the bladder muscles and nerves working smoothly together. When the bladder is allowed to fill naturally, it maintains its flexibility and capacity. The brain also learns to interpret bladder signals accurately. Over many years, this coordination becomes a stable and reliable system that supports comfort and confidence in daily life. But now, let's consider what happens when the bladder is emptied very frequently, before it has had a chance to fill properly. When this pattern repeats day after day, the bladder begins to adapt. The muscles and nerves become used to working at smaller volumes. Gradually, the bladder starts sending signals earlier than it used to, sometimes when it is only partially filled. These signals may begin to feel more urgent, even though the bladder is not truly full. This change does not happen suddenly. It develops slowly and quietly, often without a person noticing at first. Someone may simply feel that they need to go more often, or that urges feel stronger than they used to. It may seem like a normal part of getting older, but in many cases, it is actually a learned pattern rather than an unavoidable condition. Here is the encouraging part. The bladder is adaptable. Just as it can learn habits that reduce its capacity, it can also relearn healthier patterns when given time and gentle guidance. With patience and small adjustments, many people notice their bladder becoming calmer and more predictable again. Let me ask you something to reflect on. Have you ever felt a strong urge to urinate even though you had gone to the restroom not long before? Or noticed that the urge appears sooner than it used to? These can be early signs that the bladder's signaling system is becoming more sensitive, but they are also signs that positive change is still very possible. Let's talk more deeply about this very common habit. Many seniors gradually develop the routine of using the restroom just in case. It often starts with good intentions. Before leaving the house, before sitting down for a long television program, before going to bed, or even before a short walk, people think it is safer to empty the bladder, even if the urge is mild or not present at all. On the surface, this feels sensible. It feels like planning ahead. It feels like taking control and preventing embarrassment or discomfort. In fact, family members and friends sometimes encourage this habit, believing it is a practical way to avoid accidents. But the bladder does not understand intentions. The bladder responds to patterns. When it is emptied again and again at small volumes, the bladder slowly begins to treat this as the new normal. Instead of stretching comfortably and holding more, it adapts by signaling earlier. Over time, the urge to urinate may begin to appear sooner than it used to, even when the bladder is not truly full. A helpful way to picture this is to imagine charging a mobile phone battery. If you plugged in your phone every time it dropped from 100% to 80%, you might start to feel uneasy whenever the battery dipped slightly, even though the phone could safely run for many more hours. The battery itself would not become stronger from constant charging, and your confidence in its capacity might actually decrease. The bladder behaves in a similar way. When it is not given the chance to fill naturally, it becomes less tolerant of filling. Signals become quicker, sometimes sharper, and the feeling of urgency may increase. Instead of gaining control, a person may begin to feel that urges are becoming harder to manage. This can sometimes lead to leakage, especially when the urge appears suddenly and there is not enough time to reach the restroom comfortably. Many older adults assume this is simply part of aging, but in many cases, it is a learned pattern rather than an unavoidable change. Here is the reassuring part. Habits can be reshaped. The bladder is remarkably adaptable, even later in life. With gentle changes and patience, many people find that urges become calmer and intervals between bathroom visits gradually lengthen. Take a moment to reflect. Do you find yourself using the restroom just in case, even when you don't really feel the need? Or have you noticed someone close to you doing this regularly? Simply becoming aware of this habit is often the first step toward improving bladder comfort and confidence. The bladder usually gives small, gentle clues before bigger problems appear. These early signs are easy to miss because they often develop slowly over time. Many people simply adjust their routine without realizing their bladder habits are changing. One of the first signs is needing to urinate more often than before. For many adults, passing urine every 3 to 4 hours during the day feels comfortable. But when the bladder becomes more sensitive, a person may feel the need to go every 1 to 2 hours, even without drinking large amounts of fluid. At first, this may not seem unusual, but over weeks or months it can become more noticeable. Another common sign is a sudden, strong urge that seems to appear without warning. Some people describe this feeling as being completely fine one moment, and then suddenly needing to rush to the restroom the next. This happens because the bladder begins sending signals earlier and more urgently than it used to, even when it is not very full. Nighttime waking can also be an early clue. Getting up once at night may be normal for many seniors, but waking multiple times, especially if it interrupts sleep regularly, may indicate that the bladder is becoming more reactive. Of course, sleep habits, evening fluid intake, and certain medications can also influence this, so it's helpful to look at the whole picture rather than focusing on one symptom alone. Another subtle change is how daily routines begin to shift. Some people start planning errands around restroom availability. They may prefer seats near exits, shorten outings, or feel uneasy during long car rides. Social invitations might be declined, not because of illness or lack of interest, but because of quiet concern about bladder control. If any of these situations sound familiar, it's important to remember something reassuring. These signs do not usually mean something is seriously wrong. In many cases, they simply indicate that the bladder has become a bit more sensitive and may benefit from gentle retraining and supportive habits. The encouraging news is that the bladder responds well to small, consistent changes. Many people notice improvement in comfort and confidence within a few weeks, once they begin adjusting routines and supporting bladder health. Take a moment to reflect on your own experience. Have you ever caught yourself thinking about restroom locations before leaving the house, or feeling uneasy in places where one isn't nearby? Imagine how freeing it would feel to go about your day with less worry, trusting your body again and focusing more on the moments that truly matter. Now let's talk about what truly helps the bladder return to a healthier and more comfortable pattern. The good news is that improvement often comes from small, gentle changes, rather than anything complicated or difficult. One of the most effective approaches is allowing the bladder to fill naturally again, gradually and comfortably. The bladder works best when it follows a steady rhythm of filling and emptying. When we begin to trust this natural timing, the bladder slowly relearns how to hold a comfortable amount and send signals at the right moment. This does not mean ignoring strong urges or forcing yourself to wait in discomfort. The goal is simply to become more aware of the difference between a true urge and a mild sensation that may pass. For example, if you used the restroom recently and feel only a slight urge, you might try waiting a few extra minutes before going again. Often, the sensation fades as the bladder settles. This gentle pause helps retrain the bladder without causing strain. Over time, these small delays can gradually increase the time between bathroom visits in a natural way. A helpful way to understand this is to think about hunger. If someone eats only because the clock says it's time, rather than because they feel hungry, the body's natural hunger signals can become confusing. But when meals return to a more natural rhythm, the body begins to send clearer, more reliable signals again. The bladder responds in a very similar way. Another important factor is hydration. Some people begin drinking less water because they worry about leakage. While this seems logical, drinking too little can actually irritate the bladder. When urine becomes concentrated, it may stimulate the bladder lining and increase the feeling of urgency. Imagine watering a plant only once in a while with a very small amount of water. The plant doesn't become stronger, it becomes stressed and less healthy. In the same way, the bladder lining functions best in a balanced, well-hydrated environment. Drinking moderate amounts of water, spaced evenly throughout the day, often helps the bladder stay calmer and more predictable. Large amounts of fluid all at once are less helpful than small, steady amounts over time. Here is an encouraging truth. As bladder signals become steadier, many people notice their confidence slowly returning. They begin to feel more relaxed during outings, less rushed, and more in control. These small improvements may seem simple, but they build on each other in meaningful ways. Take a moment to reflect. What small change feels most realistic for you to begin with? Waiting a few extra minutes when the urge is mild, or spreading your fluid intake more evenly during the day? There is another important part of bladder control that often doesn't get enough attention, and that is the pelvic floor muscles. Many people have heard the term before, but not everyone clearly understands what these muscles do or why they matter so much for bladder health. The pelvic floor muscles form a supportive layer at the base of the pelvis. A simple way to picture them is to imagine a soft, flexible hammock stretched gently beneath the bladder and other nearby organs. This supportive hammock helps keep the bladder in the right position and plays a key role in controlling the release of urine. These muscles automatically tighten when there is sudden pressure in the abdomen. For example, when you cough, laugh, sneeze, bend, or stand up, the pelvic floor muscles help keep the bladder outlet closed. When they are strong and responsive, this process happens smoothly without you even noticing it. Over time, like any muscles in the body, the pelvic floor can become weaker. This may happen gradually due to aging, years of daily strain, past surgeries, childbirth, or simply reduced physical activity. Weakness does not mean damage. It simply means the muscles may need gentle strengthening, just like the arms or legs after a period of inactivity. The encouraging news is that these muscles respond well to simple exercises at almost any age. Improvement is often possible with patience and regular practice. To understand the movement, imagine trying to gently lift a small marble using the muscles around the urethra, holding that gentle lift for a few seconds, and then relaxing fully. The key word here is gentle. There is no need to strain or hold your breath. The goal is controlled tightening, followed by complete relaxation. Consistency matters far more than intensity. Even a few minutes of practice each day can gradually improve muscle tone and coordination. Over several weeks, many people begin to notice better control, fewer small leaks, and greater confidence in daily activities. Another benefit is awareness. As these muscles become stronger, it often becomes easier to respond calmly when an urge appears. Instead of feeling rushed or anxious, many people find they can delay comfortably for a short time until they reach a restroom. Many seniors are pleasantly surprised by how much improvement is possible with steady, gentle practice. The body has a remarkable ability to adapt when given time and care. Take a moment to reflect on this. When was the last time you gave attention to these muscles, just as you might think about walking, stretching, or keeping your balance strong? Small daily habits can make a meaningful difference over time. There are also small, everyday habits that can either irritate the bladder or help keep it calm and comfortable. These habits may seem minor on their own, but over time, they can have a noticeable effect on how the bladder feels and functions. One common example is caffeine. Drinks like coffee, tea, and some soft drinks can stimulate the bladder in certain people. This does not mean you must completely give up coffee or tea, especially if you enjoy them as part of your daily routine. The key is awareness. Pay attention to how your body responds. Some people notice that reducing the strength of their coffee, choosing a smaller cup, or avoiding caffeine later in the day makes a meaningful difference in urgency and nighttime comfort. Another helpful habit is how fluids are consumed. Drinking large amounts of water or other beverages all at once can stretch the bladder quickly and trigger a sudden urge to urinate. In contrast, drinking moderate amounts spaced evenly throughout the day allows the bladder to fill at a slower, more comfortable pace. Many people find this simple adjustment helps reduce sudden urgency. Constipation is another factor that is often overlooked. When the bowels are full, they can place pressure on the bladder because both organs share limited space in the lower abdomen. This pressure can reduce how much the bladder comfortably holds and may increase the feeling of needing to urinate. Supporting regular bowel movements through gentle fiber intake, adequate hydration, and daily movement, such as walking, can benefit both bowel and bladder health at the same time. Posture and relaxation during bathroom visits also matter more than many people realize. Sitting comfortably, allowing the body to relax, and taking enough time to empty the bladder fully can help prevent small amounts of urine from remaining behind. When the bladder empties more completely, it often reduces the feeling of needing to go again shortly afterward. These may seem like small details, but together they influence how the bladder behaves day after day. The body responds to patterns, and consistent, gentle routines often lead to steadier signals and greater comfort. Here is something encouraging to remember. The bladder responds very well to consistency. When daily habits become more balanced, many people notice gradual improvement in comfort and predictability. Take a moment to reflect on your own routine. Have you noticed how your body benefits from regular sleep times, meals, and daily movement? The bladder, in much the same way, appreciates rhythm and steady habits. While many bladder changes improve with simple lifestyle adjustments and gentle retraining, it is also important to recognize when it is wise to seek guidance from a healthcare professional. Paying attention to your body and asking for advice when something feels different is not a sign of weakness. It is a sign of good preventive care. One situation that deserves attention is when bladder leakage appears suddenly or becomes noticeably worse over a short period of time. Gradual changes often relate to habits or muscle strength, but sudden changes may have other causes that are easier to address when evaluated early. Pain or a burning sensation during urination is another important sign to notice. Discomfort is not considered a normal part of aging, and it can sometimes indicate irritation or infection that needs treatment. In many cases, these conditions are simple to manage once identified. Changes in the appearance of urine are also worth paying attention to. Urine that looks cloudy, unusually dark, or pinkish in color should be discussed with a doctor. These changes may have harmless explanations, but it is always best to have them checked so that any underlying issue can be ruled out. Another reason to seek guidance is a significant increase in nighttime urination, especially if it begins to disturb sleep regularly. Sleep is essential for overall health, energy, and mood, so addressing anything that interrupts restful sleep can make a meaningful difference in daily well-being. A healthcare professional can help by reviewing medications, checking for infections, and discussing lifestyle patterns that may affect bladder function. Sometimes, small adjustments, such as changing the timing of a medication or modifying fluid intake, can bring noticeable relief. Reaching out early often leads to simple solutions and reassurance. Many people feel relieved after a consultation, even if the findings are minor, because they better understand what their body is experiencing. Knowledge replaces uncertainty, and that alone can reduce worry. I'd love to hear from you. Have you ever caught yourself using the restroom just in case, or noticed changes in bladder habits over time? Share your experience or observations in the comments. Your story may help someone else feel less alone. This video is for educational purposes only and is not a substitute for personal medical advice. Always consult your doctor or healthcare provider for guidance specific to your health and medications. In the next video, we'll talk about a surprising evening routine that quietly disrupts sleep and increases nighttime bathroom trips, and how a simple adjustment before bed can improve both rest and bladder comfort. Thank you for spending this time with me today. Your body has an incredible ability to adapt, heal, and regain balance at any age. Small, steady changes often bring meaningful results. Take care of yourself, stay observant, and remember, health is not about perfection. It's about gentle, consistent steps forward.